I'm optimistic about the future of the NHS. I think there are opportunities for it, but there are obviously some challenges as well. It's a world-class system and it's the envy of many countries.
I think the biggest thing about that question is how hard it is to predict. I mean, if we imagine 30 years ago, no one had heard of the internet, the first PFI project was 4 years in the future, and women only made up fewer than a quarter of doctors in primary care in the NHS.
As we get into a position where there's more patient empowerment and technological stuff available on a phone where people can manage their chronic disease, how do we bridge that gap between self-care, which I think will become increasingly more prevalent through technology, and a slightly more paternalistic medical model of duty of care, and when does the NHS need to step in?
What is it that they can do themselves that will make their health as they age better, and for us as taxpayers cheaper, and for them to actually have a much better quality of life?
We see mental health becoming more and more acceptable in the way that people are talking about it, and I think over the coming years it will become normal, so that people will be able to easily ask for help. They would know where to go for help.
Everyone is crying out for more integrated care, and I think that means there's going to be more integrated data and information used in decision making. And I think finance professionals are going to have to become very adept at working with big data.
I think we will be doing less transactional type services and hopefully focusing more on the value added service that we can bring as a profession to support clinicians, managers and patients within our local health systems.
What we can do as healthcare professionals is help unpack some of that, show people what the choices are and help them make better decisions.
I think we will need that long-term sustainable settlement for the NHS, but actually I think we also need to make sure we take the opportunity now to change the model of care that we're delivering. Otherwise, actually, however much money is invested won't be enough, because the system won't be delivered in the right way to support the needs of the generations going forward, where long-term conditions and living longer with more complex difficulties will be much more common.
Work on making careers more flexible. I think young people coming to work these days don't want a 40-year career with one organisation and one employer. They want to have opportunities to do different things, work in different places, have career breaks. I think the idea of staying in one location forever is something that's a thing of the past now.
I think millennials are so passionate about causes. They have such enthusiasm, they have such great sense of fun, they have such great sense of community and energy within their peer groups. And when you get millennials behind a cause that they're passionate about, there are amazing things that can actually come out of it. And the NHS is a fantastic cause. It's the most amazing cause.